Hello guys, I'm Dr. Shaun Jones. I'm Clinical Director at Trinity Medical Center in Montego Bay. For this video, I'd like to speak briefly about a term that we've been hearing a lot of in social media, and that is the issue of personal choice with respect to taking vaccines. Now, the fact of the matter is that this seems to have arisen out of purely political reasons and seems not to have any real basis in how we deliver healthcare services. And let me just take a short period of time to explain. As healthcare providers, when we look at providing healthcare to our patients, there are two ways that healthcare can be delivered. It can be delivered individually as well as it can be delivered within the context of public health. Public health is a method of preserving the health of an entire population, while individual health is a method of preserving the health of an individual who sees a doctor. So take, for example, if somebody is at home, they get a cut on their foot and they come to my office, it's bleeding, I secure the bleeding, I'm about to stitch it, and the person says, Doc, I'd prefer not to get stitches. I know it will be a bigger scar, I know I might have a limp when it's all healed, but I'm okay with not getting stitches. Now, that's a personal choice, and I could support my patient that way. On the other hand, if someone, let's say there's somebody who lives at home with their wife, children, and their mother. They work in the hotel industry, so they are exposed to quite a lot of visitors and are at higher risk of contracting COVID-19. And I would then say to them that, hey, I think that, in terms of protecting yourself, protecting your family and other members of the community, then you should take the vaccine. Now, this person, as has been said in all across social media recently, could say, well, it is my personal choice not to take the vaccine, so I'm not going to take the vaccine. And they may very well say, I'm not taking the vaccine. But what are the consequences of that we know from a public health perspective? This person could continue to work and then contract the virus. They would then take the virus home to their wife, their children, and their mother. All those persons who were infected, the mother could very well die, and I'm speaking to this from experience. The wife who has contracted it could also die. And even the person who has contracted the disease could also die. So essentially, what we were trying to protect this individual from was not just about the individual, but it was about that individual's entire community. And when you think of that person's community, the first community an individual has is their primary family, wife, children, mother, father. Now imagine the cost to that person of knowing that they would have caused the death of either their wife or their mother because they have said to themselves that they're expressing a personal choice not to take a vaccine. So I'd like for you all to think very carefully about the terms that are being thrown at you and the things that you're accepting as the norm. Because you have to understand that with respect to even having a vaccine mandate, if a vaccine mandate is delivered, that's not something that a government implements, so to speak. That's something that has always been recommended by healthcare providers. And so if we just allow healthcare providers to lead, we will do what we have been doing over the past decades. We're here to secure individuals, and we're also here to secure populations. Two types of healthcare that we deliver: individual healthcare, population healthcare. The truth is, when it comes to population healthcare, which is what we refer to as public health, honestly, there are no real personal choices there, because all the recommendations that have to do with public health are recommendations to secure the entire community, not just one individual, but the entire community. And at this point, and with what is happening in Jamaica, each and every one of us must now recognize that we are all our brother's keepers. And if it doesn't stop with me, it is not going to stop at all. That's the philosophy. If you get COVID, you will pass it on to someone else. Do you want to be that guy? Take care, much love, and as always, remember, keep the social distancing, stay away from gatherings, wear your mask, and by all means, please get vaccinated. Things are getting pretty bad, and we're seeing it in our offices. Take care. Love.